One of my favorite, most passionate topics to talk about in clinic while seeing patients is what most people know and refer to as sciatica. What is it? How did I get it? Why is this happening to me? My life is ruined. I can't move. I want to die. Life sucks. You name it. I've heard it all regarding sciatica. And what I'd like to offer is just a little bit of insight from a clinical perspective about what it actually is. It's not even a real medical diagnosis. It's a symptom of something else, which is the medical diagnosis. Sciatica, as most people understand it, is that horrible, terrible, lancinating, burning pain that usually starts somewhere in the buttocks, maybe the lower back, and starts to travel around the back outside portion of our thigh, down the outside of our lower leg and into our foot. Sometimes it wraps around into the groin. Sometimes it gives sharp, stabbing, terrible pain around the knee and into the calf muscle. Sometimes it produces numbness and tingling. Sometimes it can even produce muscle weakness and what people refer to or describe as foot drop. You know, you look down, you try to pick your toes and your foot up off the ground, and it just doesn't work. There's no signal there, for example. The analogy I like to give to patients is that it's like a heavy piece of furniture sitting on the power cord coming to my exam table, and when I step on the foot pedal, the table can still come up, but it doesn't come up smoothly, or it's a little ratchety when it wants to lift up. And as soon as I can take that heavy piece of furniture off my power cord and signal can get to the table from the motor, then the table can move with lots of good functional power. Well, what you're feeling in sciatic pain is you're feeling the swelling of the nerve, the peripheral nerve, because of an impingement or a chemical or enzymatic irritation of the nerve root that starts up in the spine. The lower back typically is the most likely culprit for sciatic symptoms. And usually that's an arthritic process, a degenerative process, a herniated or prolapsed disc, which many of us have heard of and have been victims of in the past or will be in the future. It can be a tight muscle in the backside of the hip. A common one is a muscle called piriformis, for example. There's even a syndrome named after it. But what I would like everybody to understand is that sciatica or sciatic pain is really just that. It's pain. I mean, it is, pardon the pun, a really big pain in the butt. But it's really just that. It's a symptom of something else. You could have a pelvic rotation that's in a rearward direction that drops a little landmark called the sciatic notch, a little too close to the nerve. You could have tightened muscles in your hip girdle, for example. You could have a tumor, for crying out loud, and have this kind of symptom. But if we educate ourselves and we just understand and embrace the sciatica as a symptom rather than as this horrible, terrible diagnosis in and of itself, we can actually begin to empower ourselves to take control of what is actually just a symptom, learn and understand what's causing that symptom, and then begin the rehabilitative process to get better, to improve ourselves, and to mitigate that terrible, terrible pain that is typically, again, traveling down the back of our leg from our buttocks and extending into our calf and our foot. Again, sciatica, not a medical diagnosis. It is, however, a very complex symptom that needs to be identified from its cause so that it can effectively be treated.